Hi, everyone, and welcome to the first session of our FHIR-side Chat series, where we sit down with leaders across the healthcare ecosystem to talk about the role of interoperability, EHR integration, and community collaboration, empowering more connected, person-centered care. I'm Katie Keating from Unite Us, and today I'm joined by Janet 𝐲𝐻𝐻, the Associate Vice President at MEDITECH, a longtime leader in the EHR space and one of our key integration partners. We're also joined by Kacey Pierman, Community Health Equity Coordinator at Citizens Memorial Hospital, a comprehensive rural healthcare system in Southwest Missouri. Citizens Memorial Hospital was the first hospital to go live with the Unite Us MEDITECH integration, and we're so excited to have you both join us today. Welcome, Janet and Kacey.
Thank you, Katie.
Hi.
Hi. So it's great to see you both live today. I had a great time getting to know you before as we prepared for this discussion. And we're going to start off nice and easy today with talking about why is it so important for healthcare organizations to focus on what's going on outside of the walls of a doctor's office, such as a patient's ability to even get to an appointment or refrigerate a medication. And how have you seen the recent changes and approach to these non-medical or SUH needs get updated in recent years? So Janet, let's start with you.
Sure. Thank you, Katie. And it's an absolute privilege to be doing this with you and Kacey today. You're doing such meaningful work, and thank you for what you do. In answer to your question, what we know is it is important for healthcare organizations to put attention on what happens outside traditional clinical settings, because social determinants of health, such as what you mentioned, as well as financial strain, transportation barriers, and food insecurity, really profoundly influence an individual's health outcomes. For example, we know that studies link housing insecurity to higher rates of chronic disease like hypertension and diabetes, as well as mental health issues. In fact, there was a recent study done in the UK and France that proved that food insecurity is directly linked to increased risks of depression, anxiety, as well as suicidal ideation. So the industry's approach to these non-medical needs has evolved significantly. Traditionally, we know clinical data systems and social services platforms operated in silos, making it challenging to get a comprehensive view of the patient's health. So now there's a clear shift towards more connected, whole person approach to care. And that's facilitated by what we're going to learn about more, the FHIR resources and standardization around interoperability, which have been transformative in bridging this gap, really allowing for standardized, secure, real-time exchange of data. And this enables care teams to better access and act on social needs directly within their clinical workflows, and provide better coordination of care and holistic care. And Kacey's, I know, going to talk about this in more detail from a real life perspective.
Yeah, that was such a really good answer. That was so good. For someone who works in a clinic, I think it's definitely very important that we provide SDOH screenings and focus on social drivers of health, because if we don't ask the questions, patients often won't give you that information because they're not going to the doctors to talk about how they don't have transportation to go to the grocery store or go apply for WIC if needed. So I think it's really important that clinics focus on doing these screenings and asking these questions, just because there's so much more to a patient's health care than just going to the doctors to get a diagnosis and leave and then try to figure it out on their own. Yeah, that's...
Thanks, Kacey. I know screening is sort of top of mind for everyone these days. There's so many initiatives. And I think for me, the question is always, so what? If I'm going to be vulnerable with you and I'm going to share this information, what action are you going to take to support that?
Yeah,
Janet?
I feel like that's sorry.
No, go ahead.
I feel like that's a big question that people always ask when they go to the clinic is, well, do I have to answer these questions? What are you actually going to do for me if I answer these?
Exactly. Janet, I think when we think about how EHRs have traditionally worked, it's been really around the documentation and the review of clinicians providing care. You think about MEDITECH's approach going forward and taking a more proactive role in identifying or acting on some of those screening results and non-medical needs. How do you all think about that?
It's a great question. And when you look at it from a macro level, what we've been seeing is that things have been evolving and the role of the EHR has become more important in terms of delivering technology and solutions that actively support population health and care of the community at large. And one of the interesting things that we've seen is alignment with these initiatives in community health needs assessments. So many of us know community health needs assessment is a requirement of healthcare organizations, not-for-profit healthcare organizations, to put together, and that includes a healthcare provider as well as community-based services, to look at what is the prevalence of chronic disease in the community, what is the prevalence of newly diagnosed mental health problems, and then also understanding what the social drivers of health are. What are some of those areas such as food insecurity, housing insecurity, even environmental concerns that are in the community, and then make a correlation between those things because one drives the other. So when you talk to an organization, this has largely been a driver when they start thinking about their strategy around how they're going to use technology as an enabler, taking a look at what their initiatives are and aligned with their community health needs assessment. So creating implementation strategies to address the identified needs and often partnering with community organizations to design and fund targeted interventions. So, you know, I think Kacey really hit on a key point, and that is in order to embed integration with such a powerful service as Unite Us, you need to look at organizationally what you need to do. And it really is about identifying non-medical needs in a discrete way up front, and then being able to understand the workflow and connect those patients to those community services. And the beauty of the FHIR-based interoperability is you can do that in workflow and be able to bring that into your EHR. And at the end of the day, what we're supporting is really a holistic person-centered approach.
Thanks, Janet. I think so much of that really comes to life when you start to think about a community health needs assessment and how you actually act on that. Kacey, I know that like from a day-to-day perspective, that's what you're doing, really connecting those resources in the community with the needs that people have. When you think about sort of some of the challenges in that work, why was it so important for you all to integrate your MEDITECH environment with Unite Us? And what are some of the challenges it solves in your workflow that Janet was just talking about?
Yeah, so I actually started working at CMH after the partnership with Unite Us and the integration took place. So all I know is sending referrals through MEDITECH and Unite Us, which is great because it's so helpful. However, when I've talked to other community resource specialists in the past, they say that some of the big challenges were you spend all this time calling agencies and hope that they would actually respond and reach out to the patient if they had time, or you spend all this time printing off information to provide patients in hopes that they actually contact the people that you give them the information for. So it's just I think a lot of the issues stem from just having like hope that people would actually do what you're trying to get them to do, because there's a difference between asking someone for help and then actually taking the steps to get the help you need. So I think that was definitely one of the bigger bigger roadblocks to getting people the assistance they needed after doing the SDOH screenings prior to the Unite Us MEDITECH integration.
Yeah. I think that it's always one of the things we talk about is always the ability to see what's happened, right? And to be able to know when you go and have that next conversation, what really happened between the last time we talked and what's going on now.
Yeah.
Kacey, I know that you are often also sort of extra challenged by lack of resources in a rural community. Are there any ways that like tools or technology can help you with that you found impactful?
Yeah, so I think that once our community started talking about utilizing Unite Us, a lot of the different community agencies were really interested in getting onboarded because one, agencies always one thing we always have in common is we're always trying to help the same people in the community, but I don't know if they actually went to 𝐭𝐡𝐢𝐬 to get food pantry benefits, and 𝐭𝐡𝐢𝐬 doesn't know if this patient went to OCAC to get utility assistance. So what's nice with utilizing Unitas is I can see where the patients have gone and if they've actually reached out for help. And if not, I can follow up with the patient to just talk about maybe doing a new referral and going to 𝐭𝐡𝐢𝐬 and making that, bridging that gap between what they said they were going to do versus what's actually happening in the moment.
Yeah, I think it's so important to be able to see that.
Yeah.
Janet, I know from, our perspective here at Unitas, it's really important for us to be integrated with some of our EHR partners because of the way it does smooth out that workflow for clinicians and community health workers. When you think about MEDITECH's strategy to deliver really connected, holistic care, how does this fit into your overall strategy?
Yeah, thank you for asking, Katie. This has been so powerful, and I just love talking to Kacey because she validates some of the past challenges as well as the current challenges around that, 360 referral loop too. And I'm sure we're going to talk about that in a little bit more detail. But I have been so appreciative of what United does. And now with some of these FHIR standards, we've been able to integrate it into workflow. And really the core here really lies in the seamless integration of Unitas with MEDITECH's Expanse EHR. That is the game changer here. That is profound. And what it allows us to do is really to kind of bridge data silos, like what Kacey was talking about, where if we can know what's in Unitas and what that key data is, and we can put it in workflow, that's going to be powerful and be able to connect those disparate systems. And that kind of leads to facilitation of actionable insights. So to Katie's point is you don't know what you don't know, but if you've got a registry of patients that you're tracking, they've been referred out, and you can very easily, one click away or bringing back into the system, see whether or not they actually followed up and partaked of those, took of those services. That is really important information, and that supports the population health management as well. Are the patients being screened? Are they being referred? Are they taking advantage of those services? And then are we seeing improved outcomes as a result? So the integration with Unitas and it has been a game changer. And a lot of it has been facilitated and accelerated by the FHIR interoperability and standardization. So ultimately, Unitas solutions have really helped MEDITECH deliver on its vision for that more connected, person-centered ecosystem where critical data follows the individual, empowers the care team, and allows them to collaborate more effectively and improve outcomes across entire communities.
Thanks, Janet. I think that is so important, is being able to follow the data no matter where it is, so that you're able to have the right information in the right place at the right time to take the right action. Kacey, from your perspective, what makes Unitas a strong partner to you, and how does the integration sort of reflect on your bigger vision of what might be possible in the future?
Yeah, so I think that Unitas is such a strong partner because Unitas truly listens and cares about how the platform works for us. I think a really good personal example of this is I'm such a silly goose sometimes, and I'd lose my head if it wasn't attached to my body. So sometimes I just can't figure things out on the platform. And out of frustration, I always email our Unitas representatives, but I would always email them and be like, I just cannot figure this out. And they actually take the time out of their, I'm sure, very busy days just to hop on a quick Zoom meeting with me to walk through confusion and frustration with me. And I think that's so helpful and very personable. So I think that's definitely one big plus about what makes them such a good partner, is the platform truly cares about how the system works for your community. I just got on such a tangent about how much I love Unitas, and I forgot what the second question was.
Well, I'm going to say selfishly, I'm not going to complain about that. I think our team members really do make magic happen for folks at times, and it's really good to hear that partnership is really is really strong, and that it supports everything from silly gooseness to technology integrations.
Yes.
To talk about the technology for a little bit, we are really excited about the integration with MEDITECH because it, of course, expands the number of our customers that we're able to provide that streamlined workflow with. And I think when we start talking about FHIR standards, they're starting to really expand out in the ecosystem. So they started really based on just like, how can I move clinical information from place to place, but also is now accounting for things like social needs, and if you're doing a prepare screening, how you can share that information between systems as well. It's that standardization of data and the ability to then share it across systems to really follow that person as well. So Janet, I think when we're talking about this, what role do you see FHIR and other interoperability standards playing in improving how organizations are able to share, track, and act on this information that can now be exchanged?
Yeah, thanks for asking that question. And now I'm going to officially be using the term silly gooseness. I love that. But to get a little techie for a moment, FHIR and other interoperability standards. So if you think of FHIR, that's really the transport methodology, the way that we share data. The standards that have been evolving are also key, whether we look at the USCDI, the CCD, the way in which that we codify data and share it has been key too. And that's really sort of reached an apex where we can leverage the FHIR standards, the FHIR interoperability standards, as well as the nomenclature standards so that we can exchange data in a meaningful way. We can from a social care standpoint, we can share, we can track, and we can act on the drivers of health from a broader, like I said before, healthcare ecosystem. So traditionally, we know clinical data systems and social service platforms have really operated in silos. This is changing, and it has changed with FHIR and Unite Us. Really, it allows you to get a comprehensive view of the patient across the continuum of care, including community services. And this is through frameworks like Smart on FHIR and the interoperability standards. Specifically, what FHIR has enabled us to do is to standardize in a secure way exchange of real-time data. So within the EHR, the MEDITECH EHR in particular, we're able to link out via one click to Unite Us. So what Unite Us is going to do is in the background, they're going to use the FHIR API to bring up a view of that patient. And they may not have known about that patient until we clicked that FHIR API. Because of the standards that are in place, they can bring forward a wealth of key data, including whether or not that patient's pregnant, all the history of the patient, and really bring value to the user so they have the full context of the patient. They don't have to re-identify the patient. They are in workflow within the EHR, and then they go into Unite Us. So that can happen initially when you're referring out, but then as Kacey was saying, if you're managing that patient or a group of patients and you want to get a snapshot of what's happened with that patient and the referrals, that's also one click away. It's all integrated into the clinical workflows, which means the care teams can access on the crucial social needs directly within the EHR for better coordination, fewer duplicate referrals, and again, that holistic care that we keep talking about. The other thing that I'll mention is, so we've got the individual patients and how we're tracking that. But the other thing that FHIR and this interoperability is allowing us to do is to be able to look at things in aggregate and look at trends. So from a health equity standpoint, to be able to look at a population of patients, identify which ones have social needs, which ones have been referred, which ones have had services, and what the impact has been on outcomes, whether it be mental health conditions, whether it be onset of new chronic diseases, et cetera. And that's really the game changer, and that's what's tying us back to the CHNA, or Community Health Needs Assessment, as well. So as FHIR adoption continues to grow across healthcare sectors, we're going to see more connected, person-centered care, and that is a game changer.
Janet, I really appreciate that perspective. You said so many things that I felt like you and I could have been in a meeting together any day of the week this week. But I think what you said about population health is really important. I think some of the power of the Unitas data tied with clinical data is really showing the impact on outcomes and being able to see, how many social interventions does it take to improve a patient's outcomes or to get a patient to a more stable place or to be supporting a condition that they're living with. And I think, as you said, being able to see that in that single longitudinal record, or being able, in the morning to quickly sort through your patient panel for the day, means that you're always, on top of that information and always understanding sort of where you sit with that patient. I think too that some of what you said about sort of the codification of that data as well. Unitas has been working with the Gravity project that has been making great leaps and strides on making sure that it's represented in USCDI, that it is represented in the FHIR API standards, so that as we continue to expand interventions and measuring outcomes and sort of taking that next step when we have the data that is needed across this whole ecosystem, that we're continuing to make sure that data is accounted for as well. So Kacey, to turn it back to you, I know you said that you have only existed in a world post-integration, which is fantastic, but as you are an early adopter, are there any initial results or learning shared from your team and interacting in this integrated environment that you'd like other people to know about, you'd like to share, or that kind of indicates that you really know how this is making an impact?
Yeah, so I know initially when we first went live with the integration, there was quite a bit of hesitation from the clinics aspect, just because it was new and we just got everyone to learn how to utilize Unitas alone. And now all of a sudden it's like, hey, we're actually going to start doing it through MEDITECH now, which is going to be so much more helpful. So there, in the beginning, there's always just a little bit of road bumps here and there, but once we got those taken care of, the process became super smooth for resource specialists, social workers, providers, anyone to just truly go into the patient's chart, click the Unitas button, and be able to create the profile, send the referral, and do everything that was needed. I feel like since the integration has taken place, we've had a lot of positive feedback in regards to the integration and how it has been utilized. People have said that it often makes sending the referrals and that whole process just so much more simpler and a lot less time consuming. Just because when you're say you're in the clinic with a patient and you tell them that, hey, I have this really cool platform, I can send referrals for you, but it takes a long time, patients are often like, no, I don't want to sit around and wait for that. But now that we're integrated with MEDITECH, it's really just easy click of the button and you can send the referral before the patient even walks out the doors. And with that being said, since we've integrated and the process has become so simple, I believe our referrals have increased on the platform. I know that we have a goal of I think 50 to 80 referrals a month, and we've been really close to hitting those goals or meeting those goals every time, just because it's so much easier for us to send referrals that way and get people connected to the resources on the platform.
That's phenomenal. I love when people can say they've hit a goal. I talk about that on my team all the time, so that's fantastic. I love what you said about before a patient walks out the door. I think there's always something about, having your clinicians full attention when you're sitting right there, and the fact that you both are really clear on what next steps are. I know that from Unitas, we will also, send an additional notification to the patient as well. But I think it's great knowing that everyone's on the same page about what's going to happen next, and then everyone knowing as well what the next steps are, and have a realistic understanding of what you're going to check back in on.
Yeah.
Yeah. Janet, from your perspective, what sort of interest or feedback have you heard from your customers as well who are considering this sort of integration? Maybe a little bit of like what brought you to Unite Us to talk about this to start with, and then any early lessons you're seeing as well.
Sure. So I've been working for years now in the population health, health equity, and social driver space, we'll call it that. I was introduced to Unite Us many years ago before we were integrated. Unite Us is a game changer, and it provides a service that is so robust and patient-centered. It's amazing. So if we can get our clients to see the value of that and then bring the integration, it's huge. There's been significant interest, even with some of the pullback from the reporting requirements, on social drivers of health. There's still huge interest from a population health perspective in this interoperability and, tying in the community health services piece of addressing social drivers of health. It not only stems from the community health needs assessment, but there's a lot that ties to value-based care as well. So if you look at certain Medicare Advantage plans and other Medicaid type plans, they want and are looking for you to treat your patients in a holistic fashion. And that goes beyond medical care. It goes to exactly what we're talking about. So organizations are, they want this, and they want us to help them implement it in an intelligent way that's going to be streamlined and make it efficient. And it's just a matter of getting the word out, working with organizations, helping them get this implemented. And I envision in the coming years, this is going to be more common just in terms of out of the gate than not. So we just need to continue to partner and assist our healthcare organizations with planning and execution. And that will help drive our efforts and help us use these technology enablers to get them to a more integrated state.
Janet, I think what you said is so important that I think sometimes we lose sight of when we have these conversations, which is no matter the administration or the reporting requirements, people still have to do their jobs day to day. And there are lots of systems that are already in place, and there's lots of programs and projects that individual healthcare systems are working on or departments are working on, really focused on whole person health. And I think it's important that we also continue to give folks tools that are going to support these programs, support reporting. And I know, especially when we think about value-based care arrangements, there's tons of studies that show really how impactful it is in supporting these additional needs to really drive down costs and improve outcomes. So I think the more data always we can provide to support those studies, the better. So I just want to thank you both again for spending so much time with us today. But now is the wrap-up question is always my favorite question, right? It's a little bit of, just what do you want to tell the world? But what advice do you have for health systems that are just beginning to look at this, or maybe they're pivoting to look at a particular area of population health, or how non-medical drivers of health can be incorporated as part of care planning and population health? What is one takeaway you want everyone thinking about from today? So Janet, I'm going to start with you this time.
Okay, actually, that's good, because I'm curious what Kacey says after me in her own experience. So my experience has been, because I'm not only interested in technology, but I also am very interested in quality improvement methodologies. And like we say, it's not just technology, it's people and process, right? So what I think a big takeaway is from my experience is, if an organization is looking at doing this type of work, they really need to understand and assess what the workflow is, what the roles are, what the data needs are at different points in the workflow, and where the triggers are going to exist. And Kacey was talking about primary care. I think this has a role in the emergency department when you're discharging someone from the emergency department. So who are all my customers? Who are all the roles? Relative to this identifying social needs. So really in 3 areas: screening, follow-up, and outcomes, right? So screening, follow-up, and outcomes. So when I'm screening, who are the roles? We have community health workers, we have providers, we have social workers, et cetera. Who are the roles? What do they need? What is the process? Where are the triggers going to be? And then the follow-up, same thing. And then sort of the outcomes and the data needs. What kind of data do we need, and how are we going to track outcomes? So my advice and experience has been that is really important, and that's a good starting point, and we can't lose sight of the people and process piece. But I'm interested in what Kacey has to say.
So you speak so elegantly. I don't know how I could possibly top a response like that. I think some advice I would give to health systems that are looking to begin on expanding their EHR capabilities is totally scary at first, having to take on a whole new system. But if you're really in the business of healthcare, it's really important to look at those separate pieces outside of just going to the doctors, because there's some, as we've said multiple times in this conversation, is there's so much more to healthcare than just going to the doctors. There's more than just getting treatment. It's all about transportation, food, housing, stuff like that, that really impacts people's day-to-day. So if your community is invested in providing community support, I think that's something that all hospitals and clinics should really pay attention to and think about providing this type of referral system for. Just because for a rural community, it's really important that we have access to these things. But I think for any community that is very invested in their community and invested in the people in their community, I think having this referral system makes a big impact in everyone's day-to-day lives, whether it's just something simple as driving someone to their SNAP appointment or helping them fill out an application so they can get low-income housing. But yeah.
I love that. Very diverse perspectives that definitely align. Kacey, I think that's a good reminder when I think about change management. The first time you do anything, it's scary, but if everyone around you has done it before, it can be a little bit less scary to get started.
Yes.
Yeah. So I want to thank you both today for joining us and sharing your perspective. It's really exciting to us to hear from our partners. MEDITECH and Citizens Memorial Hospital are certainly leading the charge in helping providers deliver this more connected, community-centered care. And we really appreciate you sharing your perspective with us. I also want to thank everyone watching and who joined us today. If you're interested in learning more about how Unite Us can integrate with your EHR workflows to connect patients to care in the community, please connect with our team at uniteus.com to continue the conversation. This is one in a series of fireside chats we'll be having, so hopefully you'll stay tuned for next time. Thank you all.
Thank you.
Thank you.